Spondylolisthesis is a long name for the condition whereby one of the vertebrae in the spine gradually, over months or years, starts to slide forward on top of the vertebra underneath it. The two most common types of spondylolisthesis are, the first one is one that is associated with a small stress fracture or pars defect in the spine. And this is known as an isthmic spondylolisthesis, which tends to occur in adults in their 20s and 30s. And the other type of spondylolisthesis is known as a degenerative spondylolisthesis, and this is when, as a consequence of wear and tear in the spine, in patients in their 60s, 70s or 80s, the same malalignment in the spine starts to arise. So in terms of the symptoms of a spondylolisthesis, many patients initially start off with low back pain, but as the vertebra gradually over months and years move out of position, it tends to produce narrowing around the nerves in the spine. So patients will typically start to develop pain that spreads down from their back through their buttocks and into their legs, which may be made worse when they're walking. And some patients may get numbness, tingling or heaviness in the legs associated with the nerves being trapped, which is often exacerbated by walking and relieved by rest. Some patients may find that bending forward makes their symptoms slightly better, and extending or standing upright may make the symptoms worse. Very occasionally, with all forms of spondylolisthesis, the spine can slide into such a position that the very delicate nerves that provide control of your bladder or your bowels, or the sensation to the saddle area between your legs, can be affected. And if you start to develop these symptoms, even though it's very rare, you should seek out medical attention the same day. Many patients who have a spondylolisthesis can get very good control of their symptoms with a combination of regular exercises, either supervised by a physiotherapist or an osteopath, or by carrying out yoga or Pilates. And equally, many patients will find that simple analgesics will be enough to control their symptoms. Only in the setting where physiotherapy and painkillers are not enough to control the symptoms should you come and see a spinal surgeon, when we can offer more invasive techniques. If surgery is required to treat the symptoms of trapped nerves associated with a spondylolisthesis, then the aim of surgery is to free up the trapped nerves. And if we do that, around 80 to 90% of patients will find that the pain in their legs will either be improved or go away completely. Your surgeon will normally perform a variety of tests before planning a surgery to see whether the bones in the spine are actively wobbling or moving as you move. And if they are, your surgeon will normally recommend that the spine is stabilized using a combination of screws and occasionally a spacer that's placed between the vertebrae to fuse the spine. Although increasingly now, many patients, particularly patients as they get older, do not need fusion and can be managed with a simple decompression of the nerves.